Hi, this is Maddie, and I'm going to be showing a step-by-step instruction on how to insert a peripheral IV. So I have my checklist here, and the first step is preparation, and I'm going to be identifying the indication for the peripheral IV insertion for the patient. So for my patient, she is an adult who is getting IV fluids and antibiotics. And then I'm going to determine the necessary gauge catheter. So based off of the indications, she's an adult getting fluids and medications. A 20 gauge is the standard for that. And then I'm going to identify appropriate potential sites for the insertion. For an adult and a 20 gauge, the easiest sites for that would be antecubital, which is the elbow, or you can go distally, which is the forearm, or in the hand. Next step is to gather all of my supplies, which I have everything prepared. I have my IV catheter, a transparent dressing, a chlorhexidine swab or an alcohol wipe, tape, a tourniquet, a flush, an extension tubing, this one is a J-loop, and gloves. So now to start the procedure, I'm going to start by performing an hygiene and introducing myself to the patient and confirming that I have the correct patient with 2 appropriate patient identifiers. Hello, my name is Maddie. I'm one of the nurses here. I'm here to place an IV as you have some fluids and antibiotics ordered.
Okay.
Can you confirm your name and date of birth for me?
Yes, Lydia Stern, age 2480.
Thank you. That matches the information that I have, and that matches the information on her wristband. So I've also explained the procedure to the patient, the reason that she's getting the IV, and that's what I'll be doing. So I have my supplies set up. To continue setting up supplies, I'm going to open my extension tubing and get that primed. Just flush it with the saline so it's ready to connect to the IV. Next, we're going to apply your gloves and go to apply the tourniquet to your identified site. All right, so now that I have identified a potential spot for the IV insertion, I can go ahead and take a look at the site. So I can see in her AC that there is a visible vein here, but it's important to palpate it as well. A visible vein does not mean automatically a good vein. So I'm going to place the tourniquet about 2 to 3 inches above the site of insertion. I'm going to palpate the vein, checking for dilation and a bouncy feeling. So it feels nice and bouncy and plump, so that's a good vein. So I'm going to go ahead with my alcohol wipe and cleanse the site. Thank you. And you're starting at a 10 to 15 degree angle at the vein. You're going to puncture. All right, you're going to feel a poke here. Once you see blood flashback in the catheter or blood chamber, lower the catheter about to a 5-degree angle, advance it slightly, and then you can advance the whole catheter. Then you can remove the needle or engage the safety mechanism. Attach your extension tubing. Remove your tourniquet. And slightly aspirate the saline flush to check for blood return. Beautiful. Now you can flush the vein. And assessing for discomfort with the patient. Any pain while flushing?
No pain.
There's no edema around the site or redness. So you can go ahead and apply your transparent dressing. And then secure with another piece of tape, that extension tubing. Then you'll just put any sharps into sharps container, perform hand hygiene, and then document the ID insertion in the computer.